Hello and welcome to another episode of Careers and Coffee. Today is Thursday, May the 27th, and it's actually sunny for a change here in Norfolk. And today I'm delighted to welcome Sarah Okatan from Norfolk and Suffolk Social Care. Hello, Sarah, how are you?
And it's lovely to be here, so thank you.
Yes, really nice to see you. And I can't believe it's actually sunny, but that's brilliant. So to start with, Sarah, if you'd like to tell people what your current job is and who you
Yes,
work
of course, absolutely. Well, my name's Sarah Okatan, and I work for Norfolk and Suffolk Care Support in Norwich. We do a few things. We promote careers in social care, and so I come along to lots of events like this to talk about the joys of working in social care. We also provide support, advice, and guidance to the social care sector. And what I do myself is provide advice and guidance to unpaid carers. So people like me and you at home, perhaps caring for a friend or relative. So that's what I do, Madeleine.
And so what will it, like, for instance, a typical day be?
A typical day would be, they tend to be quite mixed. There are always projects that I'm working on, but you'll know that things change all the time and new things will come in. So I think a typical day might be I might start the morning making some calls to carers, offering them some support over the phone, and I'll signpost them to various different organisations that can support. I might then move on to speaking to schools and colleges about social care information sessions that we can organise, planning those sessions, thinking about the myths around social care and the various resources and how we can differentiate for our audiences. I might well go to some meetings on platforms like this, so lots of Zoom and Teams meetings. I will probably get some phone calls from people working in social care, perhaps a manager that has an issue with a member of staff and needs some advice. So very varied, very different. Lots of talking on the phone, lots of contact with people, which I love, and it'll be nice to get sort of to face again, definitely. But while we have this sort of online presence and this way of virtually connecting, it's been good. But I am looking forward to getting out and about again.
Absolutely. But although you're in health and social care now, didn't start that way, did you? Because at one point you were in Turkey.
I was, yes, I was. And I actually have, if you can see, my Turkish coffee. So I'm drinking my Turkish coffee now as we speak. Well, it's coffee and careers, so I thought I'll have a Turkish coffee. Yes, I was born and raised in London. I grew up in Hertfordshire. Somehow at the age of 30, I ended up in Istanbul. So I met my husband, who is Turkish, and went over to Istanbul. Thought I need to find work, so I trained to teach English as a foreign language. So I gained my CELTA qualification in Istanbul, and yes, so I started teaching over there. I was teaching in an English language school for adults. I've taught a primary school. So I remember talking about the Turkish coffee cup. When I was training to do my CELTA course, it's a Cambridge certificate, English as a second language. I remember thinking, I need to make this lesson exciting. This is a group of 20 adults. They're learning English. This is my practice. This is my chance to sort of show what I can do. And I thought to myself, well, I could ask them how to make the perfect Turkish coffee. So I did, and I thought to myself, well, I've got a new Turkish husband. I'm newly married. I've got a new mother-in-law, and it would be wonderful to know how to make a decent Turkish coffee. So so I asked the students, and they loved that. They enjoyed telling me, and they all had something different to say, of course. And then, of course, I shared my knowledge with my husband and mother-in-law, and was able to make a very good Turkish coffee, and it's something I've always remembered. So yes, that was quite a different thing. That wasn't on the list of plans at all. One of those sort of things that comes to you almost by accident, but a great string to my bow, and I loved tutoring. I really enjoyed it.
Excellent. So when you were at school, going back to the sort of very beginning of your,
Mm.
what were your plans when you were at school? Or did you actually, did you have any careers plans? Did you get any careers advice when you were at school?
Yeah, I remember it wasn't a lot of careers advice, I'll be honest with you. We did have sessions around, I think there were questionnaires, and we could sort of fill in questionnaires about things that we wanted to do and things that we enjoyed. But I had a very random selection, honestly, Madeleine, of career choices. I'd thought about being a cook, being a nurse, being a teacher. I was into forensic psychology for a while. I think I'd watched a program on TV and got into forensic psychology. So lots and lots of plans. I finished my GCSEs and I had planned to do a BTEC, as they were at that time, in catering. Changed my mind, thought, no, I'm going to do A-levels. Did my A-levels in chemistry, physics, and environmental science. And anyone who knows me will know that I'm perhaps not the most scientific and logical person, so quite an interesting range of subjects. But then I planned to work in the sciences. I had this bee in my bonnet about working in forensic psychology. So, of course, I studied psychology as well. Didn't do very well because they were very difficult subjects, and they weren't the subjects for me. So went back and did my A-levels for a second time and chose sociology and psychology again and did very well. And that's where I found my niche. So I enjoyed sociology and psychology very much. Went on to do a sociology degree, which again I love. So yeah, I had a lot of ideas at school, I think, and I wasn't really sure what was the right thing. I think a lot of the ideas I had were sort of things I thought I should be doing. And as I've grown older and I've done different jobs, I've thought more about what I actually like to do and what I want to do. So I think that's really important in careers guidance. And any students listening today, I would say, think about what you want. Think about what makes you happy, number one.
Absolutely. Yeah, because we spend a lot of time at work, don't we?
Yeah.
I think sometimes now, because working in careers, we spend a lot of time and actually sometimes focusing on students who don't know what they want to do. But we sometimes, I think, forget that there are students out there who's maybe getting particular pressures from family to actually follow certain footsteps, and this is where I think independent careers advice is extremely important, because it is focusing on that student, isn't it? And actually finding out what they really want from life, what's important to them. Because we spend a third of our lives at work, don't we? Completely and utterly. So it is really, really important. I mean, we've got a new person on our board here, CJ Green, and I remember she said that to choose a career that will exist in the future, that's one thing that she gave advice about. And she said it should involve creativity, complex human situations, and something that are unpredictable, that can't actually be automated. And I thought that was really, really, really important. And she said the careers are like a triangle. You've got the lifestyle, the job satisfaction, and the money element, and you need to work out what it's important to you. And she said something I thought was really cool. Your tribe is your vibe. It's all about the people you spend the time with. And this is where I kind of think that I know when we've spoken before, and you've come along and done events at schools and things like that, and you've spoken about health and social care, it's a sector where there are lots of myths, isn't there? People think that it's you go into a job, it's very poorly paid, there's no progression, etc., etc. So but I've heard you talk about in a completely different way, that about the amazing people. So that's CJ's comment about your tribe being your vibe. The amazing people who are in the sector. So maybe now would be a good time to sort of bust a few of the myths. are in the sector. And I mean, I remember you told me recently that you could actually, that health and social care has, there are more jobs in health and social care than there are in the NHS, for instance.
Yeah.
And that there are, you know, you're a bigger employer locally than the NHS. The NHS is a massive employer here.
Absolutely.
And
Yeah,
also that I remember you saying that everybody who joins gets training to at least a level 2. So and maybe you can share with us a few more of the myths for anybody watching, you know, for students, and why also you often say to me it's a career for anyone because of what you
absolutely. Of course I can. That's absolutely fine. When I joined Norfolk and Suffolk Care Support in 2019, so not that long ago, I didn't know much about social care, honestly. I had been working previously, quite a few years ago, for the NHS Careers Service, so I knew a lot about NHS careers, and I knew how big the sector was, and I knew about the challenges in recruitment of staff. Then when I joined the social care sector, I thought, well, the NHS has got nothing on us, you know, absolutely. We're a huge sector, a very important sector. We're an aging population. Our needs are going to increase, and it's very likely that all of us at some point in our lives will need some kind of care, whether it's us or a relative. And the social care system really backs up and supports what the NHS is doing. So it's hugely important. It's a huge, huge employer within Norfolk. There is such a range of, private establishments. There are different types of providers. So there are, nursing and residential, which you might know about. You might understand about, care homes for the elderly. That might be a myth, which I'll come to. And you might understand a little bit about, well, there might be care workers that come into your home and care for you at home. But the sector is massive. The job variety is there. You can basically do any career, any job that you want to do within social care. So if you're an IT professional, or you're into marketing or business or cooking, or gardening or maintenance, there is a job for you. And we have talked to students who have found and have started to research jobs in these fields. So fantastically huge employer, lots and lots of opportunities. I suppose if we're talking about the myths, the first one I kind of highlighted for you was the fact that a lot of people think it's all about caring for elderly people. So it's all about care homes. It's all about caring for elderly people, but it's not. You might find yourself working in a residential home, but you'll be looking and supporting people with learning disabilities. You could be supporting someone of a very similar age to you with a learning disability, perhaps with autism, perhaps with a physical disability. You might be supporting them in their own home, and that would be, you might take them to the bank and do some banking with them. You might do some shopping with them. You might even be able to take them to the cinema or to bowling. So what you're doing is much more than caring for people who are frail. You are giving people independence. You are helping people to live their own independent lives, whatever age they are, whatever abilities or disabilities they may have. You are supporting people to live dignified and independent lives, which is so important because that's what we all want. Everybody wants that. So in terms of the myths, low pay, it's not low pay. There are lots of opportunities there. You can, I've just got a slight echo, bear with, that's okay. Lots of opportunities. You can come in and be a care worker. You can work your way up. You can work your way up to management. You can become a registered nurse, an occupational therapist, a counsellor. These are. Oh, I can't hear you, Madeleine. I can't hear you, but I can hear you. Oh,
can you hear me now?
Yes, I can hear you now.
Okay,
sorry about that.
Got some funny echoes. Yeah, so I remember when you told me that you could actually come in with no qualifications whatsoever. That you train people up to level 2 minimum. And there are opportunities then for people to go on through various different routes to, like you say, become a state registered nurse, become an occupational therapist,
Mm-hmm.
go into training, on the computer side, catering, maintenance, all sorts of different fields. You think of, just a myriad of different jobs. So there really are incredible opportunities.
Absolutely.
There, and to be able to do an apprenticeship and things like this.
Yeah, that's it. I mean, you can leave school, you can go into you can work for a care provider, perhaps a residential home. Anyone joining a home or joining a care provider, any kind of setting, whether it be in the community or in a residential nursing home, with a good induction, you will all have what we call the care certificate. And this is a standard it's a set of standards that everyone needs to follow working in social care. And you will have that. So you can come from school, you can come straight into working for a provider, perhaps a nursing home. You can do the care certificates. The most important thing with social care, and it's really important to stress this, is that values are really important. So again, about the myth busting, a lot of people say, oh, well, I'm not suited to social care. I'm not the right kind of person. Well, I don't really know that there is a particular right sort of person. There are lots of right sort of people that work in social care, but values are so, so important. Care, commitment, willingness to train, willingness to learn, understanding and appreciating that people want to live an independent and dignified life. We quite often say, think about your relatives, think about your mother. What would you want for them? What would you want for yourself? And that's what we do in social care. We're caring for people in a way we'd want to be cared for ourselves. So if you have that love, that commitment, that want to help people, that desire to make a difference, social care's for you. And then you've got that range of careers and that range of training options. You can come in and you can start at the bottom and work your way up. You can work your way sideways and back down. There's so many different routes, as you know, Madeleine. And you can do if you want to, you can do some preparation perhaps before finding a job. You could do a level 1, preparing to work in the social care sector. You could do a level 2 or 3 certificate, again, preparing to work in adult social care. You can come in with neither of those. You can come in and say to a provider, I want to work in social care. I have these values. I have this drive. Train me up. And if you stick your head up there and say, yeah, I want to volunteer. I want to try everything. I want to learn. Any good provider will develop you. And any social care provider I talk to, and I talk to a lot on a daily basis, they will all say, if that person's got the values, they've got the drive, we can give them the training, all of that.
And it's also a really inclusive employer, isn't it? I remember you told me about the eye care ambassadors that go to visit schools and local places. Yeah. And you have ambassadors who also have additional needs themselves. Yes. So it's a really good way for students who perhaps have additional needs to actually say, that could be me. I can do that. Absolutely. And to give them the confidence to try. So I think that's a pretty awesome situation, really. So I've noticed you've got a question that's been posted.
Oh, thank you.
It says, what support is available for home careers? I'm not quite sure I quite understand that question. What support is available for home careers? Whoever's asked that, do they mean for people? I'm not quite sure for home careers. So
if you mean caring for people in their homes,
yes,
but I'm not entirely sure.
No, for home carers, not careers. Right, what support is available for home carers? Okay.
Of course.
Yeah. Sorry.
Well, for a few days a week, I work with and on behalf of Carers Matter Norfolk. So Carers Matter Norfolk support unpaid carers in their homes. So there's people like me and you, perhaps caring for a partner, a child, an elderly relative, a younger relative. And the idea is that Carers Matter Norfolk are there to check that you are okay as a carer, keeping an eye on your well-being, your health, Are you able to do this role? What kind of support do you need? I mean, you'll know there's lots of support out there for people who are suffering with various physical conditions. But there's generally someone caring for that person at home, and it's really important that we support that person as well, because without that person, there is a reliance. Then that person who is unwell and or physically disabled might need to go into residential care, but they've got that loved one who's doing the brunt of the work. And if we support that person, they can continue to live their happy, not happy, difficult. It's difficult. It's a difficult life, but they have that dignity. They have that option to stay in their own home. So for me, this work is really important. I really appreciate the work that paid carers do and unpaid carers do. So it's supporting those people just like me and you, with no training, no experience, having to just do our best every day to support someone that we love. So that's what I like to do. I like to be able to be that sort of supportive voice on the phone.
Excellent. And in terms of, like, for instance, so if there are young people now who are watching this and thinking, well, I think I have those values. I do feel compassion for people, and I do really care, and I do want to do something to make a difference. So what's my next step? What do I do? And I'm not sure what to do next.
Well, there are lots of things. There are lots of things you can do. I would always say to students, get onto the Google and Google careers in social care. You will find probably the first thing that will pop up will be the Skills for Care website. And I can share all of these links, Madeleine, in the chat box. The Skills for Care website details lots of different careers within social care, the qualifications required, so much information on there. There are job roles, job profiles, the kind of experience that you might need, how volunteering is beneficial, lots and lots of information. I would also suggest having a look at our website, Norfolk and Suffolk Care Support.co.uk. Again, we have lots of information about the work we do promoting careers in care. We have information about the roles available, how to get into care. We have links to questionnaires, so you might want to fill in a questionnaire and think, okay, so I'm interested in working in social care. I think I have the right values. But there are questionnaires which will look into things that you like doing, things that you don't, and perhaps skills that you might have. So that's quite helpful as well. And something I always do myself when I'm researching for these sessions and when I speak to students is I always suggest they look at the Norfolk Care Careers service. So it's norfolkcarecareers.co.uk, and that way you can look at live vacancies. And this is useful because you can see the kind of jobs that are available. You can see where the providers are. So you might think, okay, so I'd like to be a care worker in Attleborough in a nursing home. Okay, so you can see that. You can see the kind of duties that you'll be doing, the level of responsibility that you might have. You can see the qualifications, what the induction is involved, lots and lots of information like that. So I think it's really good to look at live vacancies, because if you've got an idea of what you'd like to do, a particular career, particular job, you can see what's involved and you can see what qualifications you might need. And then you can obviously fill those gaps. I would always as well, and it has been very difficult with the pandemic, but I would always try to speak to social care providers. So, for instance, if you have a home care agency or you have a residential nursing home in your town and you're interested in working in social care, give them a ring. If you're confident, give them a call, talk to them about who you are, what you want to do. All providers that I know of are very interested to speak to young people on the phone. It's a shame that things with visits are not 100% at the moment because of the pandemic, but normally you can visit a home and you can do a tour and you can speak to the staff. And the managers I speak to every day are always very interested to hear from young people who want to work in social care. So get on the phone if you feel confident. Don't send an email. I think everyone's swamped by emails on a daily basis. Get on the phone, get your CV together. If you feel confident and you're able, knock on that door and say, hello, I'm interested in working with you. And, providers, they will respond positively.
Absolutely. I think that's a really good piece of advice, actually. Don't just send an email, because I think we all received a lot of emails anyway before the pandemic, now even more so.
Yeah.
So for somebody who actually, I think they tend to stand out if they actually pick up the phone and say, even if it's very shyly saying, hello, this is me, I'm interested in a career in social care, I'd ask for some help and advice on the phone and just say, this is me, this is what I like doing, and take it from there. Because like you say, I've worked in recruitment myself, and I kind of think when you have somebody who gets on the phone and actually asks, or in the days when you could knock on the door, those applicants tend to be the ones who stand out, aren't they? Rather than just sending an email, because it is very obvious to anybody who's been in recruitment, isn't it, that when somebody sent out a global email in the same way that they send to everybody else. Absolutely. I think it's really important to make it personal, find out a bit about that care home or that that provider. Have a look at the website and see what they're about and what their ethos is, what's important to them, what they're trying to do, and to actually then think, yes, well, that one might be for me, that one might not, but to actually that one might suit me a bit better. And I think when somebody's done their homework, when we're looking to recruit and you come across a youngster who actually knows about your business, I think that makes them stand out as well, doesn't it?
Definitely. And I think I understand how difficult it is to get on the phone. I remember as a teenager myself having to organise my own work experience, and those first initial phone calls, applying for jobs and things. I was terrified. I absolutely hated getting on the phone. And if I'd had an option, if there had been email, I probably would have used it, but I couldn't use email because there was no such thing. So it was get on the phone, or it was go to the store and talk to the person face to face. So I did get there, and it got easier, and it's that initial call, that initial visit is difficult, it is nerve-wracking, but you will get a positive response. And the more you do it, the easier it gets, like anything. So definitely, if you can find that confidence, put that smile on and get on the phone, most providers will be really happy to hear from you.
And it's funny when you say put a smile on, I think you can almost, even though you're talking to somebody on the phone, you can hear when somebody's smiling.
Definitely.
I hate to say it, but we've run out of time.
Oh,
so
okay.
It's a real shame. We could sit and chat. I know we could all day. But Sarah, I'd like to thank you so much for coming on and chatting about careers in health and social care, why it really is a career for anybody. It's a very inclusive employer. And, for anybody who's interested, to pick up the phone and contact your local provider. So thank you so much. And I look forward to seeing you soon. Thank you.
Right. Thank you. Lovely to see you.
Bye-bye, Sarah. Okay, so that was Sarah Okatan, and with lots of really good advice for careers in general, for looking for work in general, and why health and social care really could be a career for all. So, so there's a couple of websites to have a look at. Local websites, so really good advice there. And so it's half term next week, so there's no Careers and Coffee next week. So we will look forward to seeing you on Tuesday, Tuesday the 8th of June. Where am I? Tuesday the 8th of June for our next Careers and Coffee. In the meantime, thank you, and please do fill in the survey below. We'd love to have your feedback. Thank you so much. Bye-bye.